Hi, I'm Gary White for Channel 6, Central Kentucky Television. And I'm here with Dr. Trish Ciccone at Central Kentucky Optometric Associates. It's a new year, 2020, so we want some 2020 vision, right?
Yes, absolutely. We want to make sure everybody gets 2020 in 2020.
That's right. And when people, that's a question actually, before we start talking about what we're going to talk about. When we talk about 2020 with your vision, what's that actually mean?
It means if you have 2020 vision, that you can decipher an image that subtends 2 minutes of arc from 20 feet away. Got that?
I'm glad you know what that means. But that's the best to have, right?
You know, well, you can actually even have 2015 or 2020 or 2010. You know, so but the standard is 2020.
2020.
You know, that's the standard that we shoot for everybody.
Okay, so 2015 or 2010 is actually a little bit better.
Yeah, and there are people that do have that, but the human eye is really kind of configured, and 2020 vision is the standard.
Okay, so we're shooting for that for the year 2020, and to kick off, January is National Glaucoma Awareness Month. So we want to make sure people, one, know what glaucoma is, but also what they can do to hopefully prevent it or treat it or whatever.
Absolutely. Glaucoma is a condition where you have atrophy or change in structure of your optic nerve that eventually correlates to change in function of the optic nerve, and that correlates to vision loss. So you have vision loss that's associated with a change in structure of your optic nerve. Now, we used to think in the olden days that glaucoma was a disease of pressure alone, and if you had high pressure, it caused damage to your nerve and you lost vision. But we now know that there are people that have glaucoma to changes in their optic nerve that have pressures that are perfectly fine and perfectly normal, or they're susceptible to the changes in their nerve at normal pressures. That might be a better way to say it, and that can be confusing. But there are other factors that come into play when someone develops glaucoma. There's what we call ocular perfusion pressure, and if your ocular perfusion pressure is low, then you're more susceptible to developing glaucoma changes in your nerve and glaucoma vision loss. So and the ocular perfusion pressure is actually how the blood pressure and what is the pressure of your blood pressure to the optic nerve. And in some conditions, especially when you're sleeping, or if you take blood pressure medicine and you take it right before you go to bed, or you have hypoperfusion from sleep apnea, those all can come into play, and those can cause, or you're diabetic and you have a lot of glucose floating around on your hemoglobin instead of oxygen. Those are all things that can cause what we call normal tension or low tension glaucoma. So these folks don't have high pressures, but they still have glaucoma. And so pressure alone is not the only diagnostic determinator for glaucoma. You have to check out the optic nerve and see how healthy the nerve fibers are, and we do that by evaluating the optic nerve ourselves and by running a test called an OCT test that actually can tell us how healthy the nerve fiber layer is. And you have to do a visual field test to determine if there's any change in the function of the nerve that correlates or goes along with any changes in the structure of the optic nerve. So that's kind of a loaded question when you ask what glaucoma is. But in a nutshell, you can have open angle glaucoma, and you can have narrow angle glaucoma or closed angle glaucoma. You can have glaucoma secondary to some pigment changes in the eye, pigmentary glaucoma. You can have glaucoma associated with medicines that you take. The big one is steroids, either ophthalmic steroids or oral steroids or steroid shots. You can have congenital glaucoma. Someone can be born with glaucoma. You can have pseudoexfoliation glaucoma, which that's a condition that I won't get into right here. But there's all different types of glaucoma that you can get. Some are associated with high pressures, and some are not.
Is glaucoma something that is treatable?
It's definitely treatable. Probably one of the most dangerous things about glaucoma is if it goes undiagnosed, because the most common types of glaucoma, if the pressure doesn't shoot way, way high, but it's still high enough to cause damage, there's no pain or discomfort associated with it. So someone doesn't know that their pressure is high or is too high, and they let it go, and it causes the damage. And when the damage is done, you can't get it back. It's not reversible. So treating early and routine eye exams are really important to determine if you have glaucoma. If you have a family history of glaucoma, that's a risk factor. If you're nearsighted, that's a risk factor. If you have diabetes or sleep apnea or high blood pressure, those are all risk factors. If you have pigment dispersion syndrome or pseudoexfoliation syndrome, those are risk factors. So if you're African American, you have a higher risk factor for glaucoma, but certain types of folks from Scandinavian countries also have a high risk factor. So you got to come for your eye exams, and you got to come on a regular basis, whether you're having any vision problems or not. At least annually for most folks, especially if you have a risk factor. Some folks who don't have any risk factors, once every 2 years is probably enough.
And how fast can the onset of glaucoma occur?
It can be very, very slow and insidious, like primary open glaucoma, or some of the low tension glaucomas are very slow and insidious, and that's why they're dangerous. Or it can be really fast, and the fast kind are like angle closure glaucoma or an acute type of glaucoma, inflammatory glaucoma, angle closure glaucoma, and those generally have other signs and symptoms along with it that stuff is going on. But the higher the pressure, the faster the change can occur and the loss can occur. So some of those more acute types, there's other signs and symptoms going on that usually bring the folks in. But I tell you, I've had some cases recently where they were relatively young people and just didn't think they need to have their eyes checked, and they had severe glaucoma, and they just had no clue there was anything going on. So
when I think of pressure, I think of like a headache, just with or pain of some sort.
If it shoots up real high, there generally is some pain or discomfort associated. But if it's in those high 20s, low 30s, often there isn't. And if there's other metabolic factors going on, it may not take a pressure of 25 or 30 or 35 to cause damage. You might get damage at a pressure of 18 or 20, which are kind of considered normal pressures. So, you can't just go, pressure is not the only thing. You have to look at that nerve, and you have to get a good family history and look at other mitigating and other risk factors, and get that visual field in those people that are suspicious. So there's a lot of people that are what we call glaucoma suspects, and they have one, maybe two risk factors, and we're monitoring their nerve and watching it. We're monitoring their pressure, but we also monitor the nerve with the OCT in the visual field to make sure that there's no changes going on there. There's probably more people that are suspects than actually have glaucoma. But so we probably monitor more people for glaucoma or for the development of glaucoma, and it's almost more important to monitor them more closely before you figure out that there's anything going on. Once you figure out that there's something going on and you treat it and reduce those mitigating risk factors, then those people sometimes don't need to be monitored once you get them stabilized as often. But,
is treatment ongoing, or can you get treatment and then
it's
have
chronic
it fixed?
usually,
It is a chronic
but
situation.
sometimes in early cases, I won't say that in every case it's that way. You kind of have the choice when you first get diagnosed. The general goal is to lower the pressure in the eye and remove mitigating factors. So we'll probably either recommend some laser treatment to lower the pressure, or we might recommend some drops to lower the pressure, or a combination of both. And in more severe and more advanced cases, it may require the insertion of an anterior chamber shunt, or these little things called MIGs, which are these little mini microscopic shunts that you can get put in during cataract surgery. Either a MIG or a shunt, or in even more advanced cases, a trabeculectomy might be in order. So you can intervene surgically, you can intervene medically, or you can intervene with a laser. But in some cases, if you catch it early enough and do a laser, the laser might hold for 2 or 3 or 4 or 5 years, and so you might not have to, put the person on drops. So sometimes with younger people who are just starting out, we might recommend the laser first. In Europe, they pretty much recommend the laser before they even start on the drops, and that's becoming a little more mainstream in the United States, but not quite as mainstream as it is over in Europe.
So again, January is National Glaucoma Awareness Month, and the best way to keep yourself safe and know whether you have that is to get an eye exam.
Absolutely, absolutely.
And you can give a call to Central Kentucky Optometric Associates. They have offices in both Lebanon and Springfield to set up an appointment for that exam. And what's the phone number here in Lebanon?
270-692-1871.
In Springfield?
And Springfield, it's 859-336-9388. You can get on our website and send us a little email saying that you'd like to schedule an appointment. We also, our little Solution Reach program is you can send us a text. You can text those numbers and send a little message that you'd like to schedule something. And those girls have that program up on their computers all day long, and so if they get a text message from somebody, they'll try and get to you on that day and call back and get to you.
High tech.
Oh yeah, we're trying.
Yeah. And again, this is at Central Kentucky Optometric Associates. I've been here with Dr. Trish Ciccone, and Happy New Year, and get 20/20 vision in 2020.
Absolutely, absolutely.
Thank you.